But before we really start off on identifying causes of optic neuropathy, we need to find out the causes of pseudo-disc edema. That is, conditions in which it appears like the patient has disc edema, but it is not so. So the most important causes are medullated nerve fibers, which is also referred to as myelinated nerve fibers, hypermetropic disc, which is a small disc, and you can also have it in optic disc drusen or tilted disc or morning glory syndrome, all of which are congenital disc anomalies. So what you're seeing in this photograph is a patient who has a tilted disc. So as the term indicates, this is a tilted disc. You can see that the disc is, the axis of the disc is, this black line indicates to you that the axis of the disc is tilted. And it is usual that these patients with a tilted disc have what you call a myopic astigmatism. This myopic astigmatism occurs because of the disc being in an axis of the center. And what is of more importance for us for clinical diagnosis is that you can see an amount of peripapillary atrophy, and also the direction of the tilt is usually inferonasal. So inferonasal tilt is usually present, where there will be thinning here in this direction, there will be thinning, and there will be elevation of the this area will be elevated. So the importance here is that this patient can have visual field defects. So visual field defects in these patients is very important, because they can have what you call, because of the inferonasal defect, they can have supratemporal field defects, which can actually resemble chiasmal disease. So it's very, very important for us to make sure that we are identifying the morphology of the disc appropriately. And OCT in these patients will show a retinal nerve fiber layer thinning. But what is really of clinical importance for us in tilted disc, the superior disc will look a little elevated, and you have myopic astigmatism, and it can be a differential diagnosis for supratemporal field defect. The next important cause of pseudo-disc edema is a patient with morning glory syndrome. So this is a patient with morning glory syndrome. So what you have as a classical appearance in these patients is a disc which is slightly larger, and you have these blood vessels which are emanating from the optic disc. These blood vessels that emanate from the optic disc is the reason why it gets its name as morning glory, because it resembles the morning glory flower. You can have surrounding chorioretinal atrophy in these patients. While the tilted disc is usually a small disc, oval or a D-shaped disc, patients with morning glory syndrome have a large disc. Another very important differential diagnosis for pseudo-disc edema is optic nerve head drusen. So as you can see here in this photograph, you can see that there is blurring-like appearance of the disc margin. There are two types of drusen for us to know. That is, you can have what you call a buried drusen, or a more commonly seen drusen, which is called an exposed drusen. So buried drusen and exposed drusen, and usually drusen is sporadic, but it can be of autosomal inheritance or dominant, and it can be bilateral or unilateral. So these patients will have what you call calcified bodies. These are calcified bodies that are present in the optic disc. Now when they are present deeper, they are called buried drusen, and when they are present superficially, it's called an exposed drusen. So how really do we identify based on our clinical examination? If it's an exposed drusen, it will be obvious, the lumpy appearance that you're seeing here. This lumpy appearance is because of aggregation of calcific material. It will give us that hazy margin to the optic disc. Whereas if it's a buried drusen, there are some other pointers. So these pointers will be, these patients will have an absent cup. Then they can also have anomalous vascular patterns. Anomalous vascular patterns. There'll be increased branching, and which we call trifurcation, and these patients will also show a hazy margin to the optic disc. And it's important for us to identify the presence and confirm the presence of optic disc drusen, because like I told you, it can be an important differential diagnosis for optic disc edema due to more severe causes. So one of the easiest things to do is a B scan. When we do a B scan ultrasound, we can, when you place the probe on the eye, you can identify the area of hyperreflectivity, and that will be seen as, that will be confirmatory of a optic disc drusen. CT scan is usually superfluous. We don't do a CT scan to identify an optic disc drusen, but incidentally, if you're doing CT scan, sometimes incidentally it has been identified. Autofluorescence is a very useful investigation. It will very clearly show us those areas of calcific deposits, and an OCT can also be used to identify. Now, another important thing in drusen is we need to know that these patients have associations with angioid streaks and sometimes even retinoid pigmentary disturbances, retinitis pigmentosa. and another syndrome which is called Allergilly syndrome. Okay, and these patients, the cause of visual loss in these patients can be choroidal neovascular membranes that can develop, or serous retinal detachments. So these findings will confirm to us. The reason I've put all these findings here is because in case there's a patient with disc edema and we are not sure if disc edema of more serious causes, then we need to use all these features to help us narrow in on the diagnosis.